Hello, my name's Dr. Andrew White. You have been advised to undergo a bronchoscopy. In this short video, we'll explain what this involves, why the test is being done, how you can prepare and what happens afterwards. A bronchoscopy is a procedure that allows doctors to look inside your airways and lungs using a thin, flexible tube called a bronchoscope. We are able to sample the lung secretions to look for infections, abnormal cells, and inflammation. There are many different reasons we might recommend a bronchoscopy, but most commonly it is done to see if the air tubes look normal, biopsy any abnormalities, and to get samples of secretions. Depending on the reason why the test is being done, different types of samples will be taken. You will need to go to the endoscopy department situated on the first floor. You will be greeted at endoscopy reception and shown to the waiting area.
Good morning.
When you arrive, a nurse will check your details and explain the procedure.
Did you receive the leaflet sent out either via email or via post regarding your procedure?
They will sit with you and go through a questionnaire and take down observations such as blood pressure. They will put in a cannula so that you can be given sedation during the procedure. After this, you will wait until your turn in the waiting room. Your friend or a family member are free to wait with you, or they can leave and come back later on. Before the procedure, a doctor will come and take you through to a room and gain your consent for the procedure. They will explain the procedure to you and give you a chance to ask any questions you might have. Once in the endoscopy room, you will meet the staff who are doing the procedure and will lie on a trolley. You'll be asked a few final questions, a cuff will be applied to your arm so that blood pressure measurements can be taken, and a probe will be put on your finger to monitor your oxygen levels and heart rate during the procedure. Before the test starts, the doctor will instill some local anaesthetic gel into one or both nostrils. This is to numb the nasal passages and lubricate the scope to make it easier to pass through the nose and make it more comfortable. The doctor will also spray local anaesthetic to the back of your throat and just gargle with that and swallow it down. This is done to reduce gagging and coughing during the procedure. You'll then be given a sedative to help you relax. This is usually in the form of midazolam and fentanyl. We usually start with a small amount that we can top up during the procedure if it is needed. It is not a general anaesthetic, but you may not remember much about the procedure. Usually the scope will be passed through one of your nostrils, but sometimes the nasal passages are too narrow, and if this is the case, a mouth guard will be put in your mouth and the scope will pass through this into your lungs. If this is done, just breathe normally. The doctor will gently pass the bronchoscope through your nose or mouth. You may feel pressure in the nose as it passes. Some more local anaesthetic is sprayed onto the vocal cords to reduce coughing. When the spray happens, you will cough, and this is completely normal. The scope will then pass between your vocal cords and into your windpipe and other large airways. The doctor will inspect the air tubes and look for abnormalities. Depending on how heavily sedated you are, you may even be able to see this on the screen yourself. Often, the doctor will inject some fluid into your lungs, and then this will be aspirated back into a pot that is sent away for analysis. The procedure usually lasts 25 to 30 minutes. You may cough, feel pressure, or experience a mild sore throat, but it should not be painful. After the procedure, you will be monitored while the sedation wears off. You may have a mild sore throat or cough. This is normal. You may cough up some blood afterwards if biopsies have been taken. Avoid eating or drinking for about an hour until the numbness in your throat wears off. Take it easy for the rest of the day. Avoid alcohol and strenuous activities. Someone should be staying with you, or you should stay with someone the night of the procedure. Bronchoscopy is generally safe, but like any procedure, it has some risks. These include bleeding. Coughing up blood especially if a biopsy is taken, temporary hoarseness or a sore throat, and rare complications such as infection, breathing difficulties or lung collapse, which is very uncommon. If you experience chest pain, significant bleeding, difficulty breathing or a high fever, you should call 111. There is also a number given on the leaflet that you were given with the procedure appointment. Do not eat or drink for at least 4 hours before your appointment. This helps prevent complications during sedation. If you're taking blood thinners, these usually need to be stopped a few days before the procedure, so be sure to let us know if you're taking these medications. You should take all other medications as usual with some water on the day of the test, unless someone tells you not to. You will not be able to drive after the procedure, so arrange for someone to take you home. Someone should stay with you overnight after the procedure, or you should stay with family or a friend. If this is not possible, sometimes it's necessary to stay overnight in hospital. We hope this video has helped you understand what to expect from your bronchoscopy. If you have any further questions, don't hesitate to ask questions on the day or discuss with the lung nurse if you met them in the clinic and were given their contact details. Thank you for watching, and we wish you a smooth procedure and a quick recovery.